Perfect.
And the next one, please. I have nothing to disclose. Okay. So of note, my intent today is to use identity first language, but I may lapse into person first. So identity first, meaning autistic children or autistic adolescents. And today's talk is near and dear to me, as this is my daily practice. My intention with this talk is to ask you to consider how this information may help you as you work with children and families, and the specific questions to consider, and ones that really are founding parts of the ECHO model are what to do while you wait, and what's the next best step for children and families. The answers to those questions are not always what we think is best or what we know from our training, but it's about meeting families where they are and supporting them in their parenting journey. Over time, when I think about what kids and families have taught me, it's that my role is to be a supportive guide and witness to their experience within this, through the lens of autism. And so it's humbling. And so I think that when we think about these conversations, I think that's through the lens where I try to be. Next slide, please. So, this is the realm of my daily work. And when I think about this, I think about it before the pandemic. And I think like so many of us, right, we think about things after or during I won't say after yet. I'll say in this chapter of the pandemic. Prior to that, so prior to March of 2020, I spent most of my time in the traditional medical ones listed here. So the neurological ones, the genetic ones, gastrointestinal, feeding, and really what's happened throughout the course of the pandemic. So, very quickly we shifted. And so I think now I spend most of my time in mood regulation, sleep, and behavior. And these ongoing and persistent pandemic disruptions have affected our daily routines, right? They've affected our societal structures. They've affected the services and supports that families depend on for autistic children. And so an example of these, just kind of to go into it in a more granular way, is mood. We think of sensory differences, we think of anxiety, depression, we think of, as kids become adolescents and young adults, we think of bipolar disorder. And I think how this is manifested during the pandemic is if you're not going to school, if you're not able to leave the house, you have a higher sensory need that's not being met. And I think that with that in mind, that means it's difficult to calm down, which means it's difficult to go to sleep, which means your sleep routine is disrupted. And then the whole next day, it just is this vicious cycle that's persisted and been very, very challenging. And we think about how that affects families. It's been the stressors that they've experienced have been enormous. And so in the States, people returned to in-person learning on a more consistent basis in the fall of 2021. There's been ongoing disruptions, but I think there's been a big push to resume in-person learning after a year and a half of a lot of kids being remote. And as you can imagine, doing remote learning with any child is difficult. I think children who have social communication, attention, behavioral challenges, it's nearly impossible. And I think that it's not addressing the way that they learn best, but it's one that we had to approach because that was what we had to do to maintain safety. And people have a lot of reasons for pursuing that. But I think what we've seen is that schools are dealing a lot, and I'd love to hear what you have to say about that too, is we've heard feedback from teachers that there's just been a lot of aggression and withdrawal and challenging. So when we think about co-occurring conditions, when we think about the medical model in general, and something I've constantly had to relearn and reframe throughout my practice is we come from a deficit perspective, right? And what I mean by that is you identify something that's wrong and you fix it. And when you think about, or you try to fix it, I should say. And so that's kind of the diagnostic experience, that's the treatment experience. And when you think through the lens of developmental differences through neurodiversity, it's a very different model. And so we think about, I always think about co-occurring conditions, rather than comorbidities, which is how we think about it a lot of times in healthcare. And specifically, there are co-occurring conditions that occur outside of the diagnostic domains. When we think about those two diagnostic domains, we think of social communication, we think of restricted interests and repetitive behaviors. A co-occurring condition is outside of that. The presence of these conditions does the following. Number one, it can increase or decrease the time to diagnosis. So kids with self-injurious behaviors, regression, or tantrums, they tend to receive diagnoses earlier than kids who do not have those considerations. And again, this is data from the States. And when they've done that, it's also been 4 to 14 months earlier. So that's also significant. ADHD and other co-occurring conditions may mask those symptoms, particularly in preschoolers. And oftentimes, we're asked if a child has ADHD when they're coming in at 2 years of age. And I think that when we think about what attention looks like in a preschooler versus what attention looks like in a school-age child. So similar to data that we previously understood was based on parent report. So I think that what they've done recently, and I think this is again 2018 prior to the pandemic, they looked at co-occurring conditions based on school records and also, based on school medical records. So this is from the Autism Developmental Disabilities Monitoring Network. And they used 5 sites, and this data is actually from 2010. So a lot of times when you're hearing these published reports that are out of the Centers for Disease Control and Prevention in the States, these are from dates much earlier to that. And when they looked at about 780 autistic kids between the ages of 4 and 8, 783 kids who are age 4, and they also looked at about 1,000 kids at age 8. And what they found was that 69% of 8-year-olds, 53% of 4-year-olds had at least 4 other co-occurring conditions. So those ones that I just mentioned. 26% of 8-year-olds and 13% of 4-year-olds had at least 7 other co-occurring conditions. So not insignificant. Next slide, please. So let's flip the lens and think about it from a different vantage point. So if a child does not have a diagnosis of autism and you see a constellation of co-occurring conditions, as educators, as therapists, as clinicians, it behooves us to consider if there might be a unifying one that's present, so such as autism. In ongoing developmental follow-up, this is another consideration, as we're constantly looking and relooking at diagnostic considerations to ensure we are understanding the best ways that a child is developing. And so I think that then it also gets into this whole question of delays in diagnoses. And so I think, when Mary asked me what's going on in the States right now, we're thinking about what the pandemic has done. I think the wait lists for diagnoses are in the years, and that's throughout the country. And I think that that's a problem. That's been a problem before the pandemic. It's a tremendous problem now. And when we look at the number of specialists that exist who participate in diagnostic evaluations for autism, I think it's been a very difficult sort of thing to come to, in the fact that we're never going to have enough specialists to meet the diagnostic need. And so I think that the pandemic has exacerbated this pre-existing problem. And I think it also speaks to why we need to have models such as ECHO to address it. So we have to take a system that's not working and think about it in a different way. And so that's what this group is about. And so we're so glad that you're with us. So I'm thinking out loud here in this slide. So in my mind, when a family tells me that there's a change in mood or behavior, I go through an algorithm in my head of what we would call in medicine a structured review of system. So I go from head to toe, and I think about, is there something going on with their eyes? Is there something going on with their hearing? Is there something going on with their teeth? How about their skin? How about nails? A lot of times this happens, right? Like you might have a child who is not able to communicate the need for help or pain, might have a cavity, and they're not able to communicate that. Is there difficulty with swallowing? Are they having difficulty breathing, right? So you go through heart, lungs, abdomen, all of those things. You go into whether or not they might be experiencing pain, right? So musculoskeletal pain. There might be a rash. There might be something else that they're going through. And so that's part of what we consider. Once that medical piece has been evaluated and ruled out per se, then you go into the question of any changes that have occurred in their schedule, in the people in their lives, in their family structures, and what's going on in their community. So think about this whole second piece, right? And then if you think about it through the lens of the pandemic, that's been our entire collective experience for the past, 2 years, going on our third year with this, right? It's constant change. It's constant disruption. And if you're an autistic individual where change is particularly difficult, I think it's been enormously stressful and challenging for families. And so as providers, I think our practice is completely changed. I think the lens through which we use to look at how to support families needs to be different, and really using this pandemic lens. And so that's how we spend a lot of our times these days. I could go on about that for hours. So next slide, please. Thanks, Silvana. So I want to talk a little bit about gastrointestinal symptoms, because this is something that families bring to our attention a lot. And I don't think we've had a great understanding of what the issues are. You have a lot of report, but you don't have a lot of good data. And actually, this is a study that is led by one of our ECHO colleagues out at University of California, Davis, at the Mind Institute. So Viviana Restrepo, who's a developmental pediatrician, and she did a semi-structured interview looking at the frequency and occurrence of gastrointestinal symptoms in preschool kids with and without autism. And the participants were between the ages of 2 and 3.5. So she had about 250 kids with autism. She had 129 who are typically developing. And she looked at a comparison between those two groups, looking at developmental, behavioral, and adaptive functioning. Next slide, please. What she found was that gastrointestinal symptoms are reported more frequently in autistic kids. So about 47% in autistic kids versus about 17% in typically developing ones. And they were also more likely, so autistic children were also more likely to have multiple GI symptoms, so about 30% versus 5%. So big significant difference there. This was equally common in males and females in both groups. In those co-occurring conditions, I think this is the critical piece when we're thinking about what things look like on the outside versus what might be occurring and manifesting as a behavior. They were associated more with self-injurious behaviors, restricted and stereotype behaviors, aggressive behaviors, sleep problems, and attention problems in both kids with autism and without autism. So particularly relevant to this was that there was an increase in self-injurious behaviors, decreased sleep duration, and increased parasomnias in autistic kids. Next slide, please. These gastrointestinal symptoms were also reported more frequently, right? So I addressed this a little bit here. And I think that so if kids aren't sleeping, they're not going to behave well. If they're not going to behave well, they're also going to manifest as having some behave well, meaning that the reason for their behavior might be a medical one. So I think the take home from this that I want you to think about is the fact that what things look like is not always what they seem. And we have to be supportive detectives with families and figuring out why they're having specific challenges. And so I think that's a lot of times what we do, right? Next slide, please. I've alluded to this throughout the talk, but I think the impact of the pandemic has been enormous, right? So I think we had this sort of tenuous system that we kind of functioned in, and then you cut one thread and everything falls apart, right? So I think that this is what we're dealing with. And I think we also have an opportunity to rebuild it in a better way. And I hope that with your participation in this group and with our discussions, we can talk about what you're seeing in your own home communities and how we can rebuild the system in a better way. And that's what we want to do through our group here. Next slide, please. So this is also a point that I want to reiterate, is that the pandemic has exacerbated already existing challenges. And so early research out of Northern Italy, so when we think about this, when Northern Italy and the Verona region was the epicenter of the pandemic, so like spring of 2020, right? And so they did these forward-thinking investigators did an online survey of 527 caregivers. And these were of autistic kids. And what they found was they wanted to quickly investigate the impact of the pandemic on autistic individuals. And what they found was that many families had difficulty managing their daily schedules and free time. I mean, honestly, we've all experienced this. I think we've all experienced this in different ways, shapes, and forms. But it's nice to be home for a day or so. And then after a while, you're like, now what? And if you think about a kid who has communication challenges and behavior challenges, high sensory needs, figuring out what to do with them in a confined space, while also families trying to work and maintain their homes, it's been, I think, it's an unpublicized tremendous challenge of the pandemic. So I think we see this so much in the States. And a particular challenge we have in our region, and I don't think we're unique, but I feel like I can speak to that, is the fact that our mental health system is not designed to support autistic individuals. And so we have a mental health system that lots of times will not see them. And so I think it's been how to support families when there's no resources to help them, when as a provider, you know what they need, creates this cognitive dissonance, right? And psychologists on the team, I might not be using the term right, so feel free to correct me. But, I think about what you know is the right thing to do and what you can access for families, and that gap is enormously stressful. And I think that we see it all the time on our teams. And I think it's something that's real, and it's something that we have to think about systems like the one that you're participating in today to better support families. And so I think that this study supports that. And I hope there's continuing data that really provides us a unique way of thinking about how to better develop a better system. Next slide, please. So translating this to the States. So I think that they did a smaller study. So one that was 70 caregivers of autistic kids and youth. And what they found was there was a unique pattern of pandemic stressors. So looking at impulsive behavior, verbal outbursts, sensory concerns, and a lot of cognitive rigidity. And the impaired emotional regulation was the major contributor to family stress. And that loss of structure and routine contributed to caregiver stress. And that, I think, is our evolving and next horizon when we're thinking about the programs that we develop, the conversations that we have for families. We have to think about it differently. And so I think that next slide, please. What I'd love for us to talk about today is what you're seeing in your communities, the stressors that you're seeing on the teams that you work on, and really to think about these co-occurring conditions as a jump start for this discussion. And also thinking about if common better, you have to think deeper. You have to look at it differently. And you have to think about overall development and communication in a different way. And this loss of structure and hopefully regaining of structure that we see within this next chapter, as we desperately hope for, I think I hope that we can provide those structures that better support families and really rethink and reassess what's most supportive to autistic individuals and their families. So thank you so much for your time and attention.